This is a presentation of the LGBT community, considerations for providing competent nursing care by Cyndia Dorn, Irene Keefe, Sarah Lyles, Abigail Mello, and Samantha Slowinski.
The lesbian, gay, bisexual, and transgender culture faces challenges regarding healthcare needs across the life stages. This group often opts for invisibility and silence throughout interactions with the healthcare system due to fears of discrimination by healthcare workers. Decades of encounters with social stigma and prejudice leads to health disparities for LGBT subpopulations. Further social, legal, research, and educational reforms are necessary to promote and adequately treat the physical and mental health needs of the LGBT community.
The LGBT culture is shared by lesbian, gay, bisexual, and transgender groups. It varies widely by geographic and identity of the participants. People in this group may also be considered their family, people supportive of the LGBT culture. They have an ironic appreciation of things stereotypically linked to the culture, such as the gay pride symbol, the rainbow, and understanding of LGBT social movements, works by famous LGBT people, actors, and artists. Beliefs and values related to healthcare. They believe in being treated equally. They don't want to be discriminated against when they're receiving healthcare or judged according to their sexual orientation, and a right to medical care. Everybody in this group and culture has a right to medical care, and they sometimes have disparities in health care because they cannot provide coverage for their spouse, significant other, or their children. Support is another thing they believe having in healthcare. They want to be supported by their healthcare provider and not judged for who they are. Definition of health. These are three very good definitions of health. How would the person in the LGBT culture define health? Many people in this culture vary widely geographically and in their religion and their race. So their belief in health would be associated to how they were raised. It may be mental health, spiritual health, wholeness, and everybody in this culture has a different definition of health. How do we provide culturally sensitive care to the childbearing women? Many reported receiving supportive and affirming care, but some reported issues such as a lack of understanding and the need to explain. They don't want to have to explain that both partners are providing care for this child. That should be understood and taught in medical journals and also in nursing care. Also, the problem with insurance coverage, the family member can have a problem getting medical care due to a lack of being able to be covered under the insurance carrier, and the rights of both parents, just as if it were a step parent. They believe just because they're not biologically the parent, they should be provided the care to make a choice in that child's life. The LGBT people don't want to be discriminated against, just like any other culture. They want to be treated fairly and equally.
Adolescents may question their gender identity or sexual orientation during the early childhood development years. At some stage, they may identify as lesbian, gay, bisexual, or transgender. Parents may seek counseling or quote-unquote conversion therapy for the child that expresses his or her gender opposite of the assigned birth role. An LGBT youth may be forced to leave the home or run away. LGBT youth are at risk for social isolation, bullying, verbal and sexual harassment, physical violence, and poor academic performance. They have substance abuse issues, have increased rates of STDs in pregnancy, and homelessness. Also, they suffer from anxiety, depression, and suicide. The overall physical and mental health of LGBT children and adolescents 0 to 17 years of age is greatly impacted by their home, school, and community environment. Schools in Transition, a guide for supporting transgender students in K-12 schools, is a first-of-its-kind publication for school administrations, teachers, and parents about how to provide safe and supportive environments for all transgender students, kindergarten through 12th grade. Healthcare providers play an integral role in the life of LGBT adolescents and need further education in the areas of gender identity and sexual orientation. Surveyed residents and attending physicians at Upstate Medical University stated that sexual orientation should be addressed more often with these patients and in the course of training.
Many LGBT adults report some type of discrimination in their lifetime. This discrimination is what often leads to health disparities of the LGBT adult. While the LGBT adult does face some of the same disparities as other age groups within their culture, there are some particular disparities which should be recognized and addressed by the healthcare team. Having to face disapproving families, contending with their own struggles with sexuality, and discrimination from institutions and social groups has been linked to higher instances of psychiatric disorders among this age group. According to Zell and Arms, increases in depression, anxiety, and suicidal thoughts have been reported, and LGBT adults are reported to be at double risk for self-harm. These increases in mental distress often lead to participation in risky health behaviors such as smoking, excessive drinking, and drug use. Substance use disorders were more than twice as high among LGBT adults than among heterosexual adults. In order to provide care to the LGBT adult, we must first understand the issues they face. Increasing cultural awareness will ensure that we are well educated and able to provide skilled care. Once we understand issues faced by the LGBT community, learn to recognize and screen for mental health issues and polysubstance abuse, as well as other disparities, we can provide information needed to best assist the patient. Being knowledgeable of resources within the community such as Alcoholics Anonymous, Narcotics Anonymous, LGBT Center of Raleigh, and Equality, North Carolina, will allow us to provide individuals with psychiatric disorders and substance abuse much needed support. The nurse-patient relationship is an important aspect of nursing. Using non-judgmental, open-ended questions regarding marital status and sexual orientation on assessments should be implemented to allow patients to express sexual orientation openly and to provide an adequate health history. Benefits of addressing health concerns and reducing disparities of the LGBT adult include increased physical and mental health.
Chronic and acute health issues are faced by any elderly person. Aging, lifestyle, and genetics contribute to cardiovascular, respiratory, gastrointestinal, genitourinary, and neurological illnesses. In addition to those, the elderly LGBT population is at risk for many other physical and psychological diseases and disorders. Lack of physical activity, social isolation, alcoholism, tobacco dependence, use of illicit drugs, high-risk behaviors, victimization, and violent experiences are risk factors that surround the LGBT community. These factors contribute to obesity, depression, anxiety, suicidal ideation or self-mutilation, substance abuse, and HIV exposure, particularly among the transgender population who lack social support and may feel unsupported by the non-transgender LGBT community. As antiretroviral therapy continues to improve, persons suffering from HIV infection are living longer lives, but the effects of the disease and medication regimen cause inflammatory responses, contributing to cardiovascular disease, lung disease, liver disease to include hepatitis B and C, type 2 diabetes, lymphoma, and HIV-associated neurocognitive disorder, or HAND, which are deficits in attention, language, motor skills, memory, and other aspects of cognitive function. Disparities exist among the health care provided to people identified as LGBT, and particularly those who identify themselves as transgender. Many have a fear of accessing health services because of discrimination felt by healthcare workers and physicians. In addition, many do not have healthcare insurance or the ability to afford services. Internalized stigma and identity concealment, as well as discrimination, harassment, victimization, and violence are all obstacles in providing adequate healthcare to the LGBT elderly. Lack of social support and in particular for the transgender population, the lack of community belonging, lead to poorer health outcomes. Many LGBT suffer financial strain and unemployment due to discrimination and workplace harassment. Even within the LGBT community, discrimination exists in the form of ageism, where the younger generation isolates itself from the elderly population and they're left alone and unsupported. Nursing and the medical field can take action to eliminate disparities and promote health among the elderly LGBT population. The focus should be on respecting one's independence and providing quality care, as well as respecting one's sexual privacy. Methods proposed include promoting equality of treatment, the need for training medical personnel in LGBT concerns, providing supportive assisted living facilities protected by federal regulations, recognition of dominant healthcare issues and unfair legal practices, increasing research into LGBT-specific needs, and developing a culture of respect for the roles of partners and significant others. Among the most important legal and societal issues that need clarification and legal support is the identification of spouse or partner as healthcare power of attorney in the event of incapacitation. This includes providing a nurturing and supportive environment at long-term care facilities to allow loved ones and families of choice to be at the bedside of the person as their time of death.
Lesbian, gay, bisexual, LGBT supporters, transgender individuals, and subcultures united by a common culture and social movement. These communities celebrate pride, diversity, and individuality. The LGBT community is diverse in race, political affiliation, ethnicities, religion, etc. Not all LGBT individuals consider themselves part of the LGBT community. Groups that may be considered part of the LGBT community include LGBT rights activists, gay villages, student groups, or religious groups. The category of LGBT includes a range of different types of sexual minority individuals, and within each of these categories are a diverse array of individuals who are also members of other oppressed groups, such as women, people of color, or people with disabilities. Even when people share membership in some of these multiple identity groups, each individual will have his or her own unique set of reactions and experiences. The double or triple minority status that some LGBT people experience may increase their difficulties, both in terms of how society treats them and in terms of how they juggle the nature of membership in these multiple identity groups. Some ethnic minority LGBT individuals even feel that they must choose between being LGBT and being a member of their own ethnic group.